Welcome to Health and Wellbeing Live, sharing knowledge and experience from Nottingham City. We are keeping people informed about issues, people, services that support the health and wellbeing of people in this great city of Nottingham. This is a relaxed podcast style conversation pitched at an interested and informed audience. There'll be little dumbing down. We'll be talking about real issues and going into some depth where we need to, but it is open to anyone to listen. Today, we will be talking with Rachel Green, who is the General Practice Nurse Lead for Nottingham City. And just out of interest, I'm Dr. Andy Foster. I'm a GP. I'm a director at NCGPA, and I work with the Place-Based Partnership in Nottingham City as well. Hello, Rachel.
Hi, Andrew.
Hi there. So today I'm excited to be chatting with you. We're going to be talking about, I guess, the challenges facing general practice nursing, some of the solutions that are being proposed and that you're trying to put in place. You've told me that we'll be talking about a conference which is coming up, which might be of interest to those working in nursing and general practice, but also healthcare assistants and other kind of allied professionals as well, or nurses in training. And we'll also be touching on potentially ARRS staff, agenda for change, and some of those areas that can be a little bit more thorny and difficult to talk about. And I think we're going to go there today, so it'll be interesting to see what we have to say about that. But it's great to have you here, Rachel. Shall we dive in? And I'm going to ask, what is a lead nurse for those who haven't heard of it?
So in my context, a lead nurse is someone who supports the nurses on the ground floor, supports them with all aspects, including recruitment, retention, reform. That might involve looking at how we can sort of represent the voice of general practice nursing, how we can sort of escalate some of the concerns to higher levels, PCN level, maybe even ICB level, to see that if we can look at some of the challenges that they're experiencing in practice. There are three of us across Nottinghamshire. So there's myself and my colleagues, Gemma Bird and Kirsten Taylor. Gemma works in Mid Notts and Kirsten works in South Notts County.
Great. And I know when we were preparing for the podcast, I was sort of saying, well, what does your week, look like? What do you do? And you got your calendar out, and you're able to tell me what your typical month or week looks like. So what sort of things are you up to in your role?
Yeah, so I will attend various meetings with various different groups. So, for example, that could be the Place-Based Partnership, it could be NAF, it could be Nursing Midwifery Council, it could be helping on specific working groups where general practice nurses can influence certain decision making. So it could be around wound care strategies or nursing associate competencies. So yeah, various different meetings that I attend each week.
Yeah, it sounds really, really varied. Yeah, great.
Yeah.
I get the sense that this role, and I might be wrong, but I'm wondering actually why we need a lead nurse. Why has it been created? I get the sense that there was perhaps a perception of challenges in general practice nursing, and that this is part of the solution. But what's your thoughts about how we came to have a lead nurse, or what led to that?
So I think there's been a gap really for a long time. General practice nurses can feel very isolated on the ground floor, and some practices will have a small team of nurses that work very well together and will have their own lead nurse within that team supporting one another. Other practices aren't so fortunate, so they may have just one practice nurse, or maybe they're running on locum nurses because they're struggling to recruit. And for nurses working in that isolated environment, it can be very challenging to know where to turn, who to ask for advice, where to seek that support, the training, the ongoing sort of career development. It might be issues that are more related to more practical things like, they're learning how to do immunizations, or they're learning how to do smear tests, and they're not sure, where to go to find that support. So I think the need has been there for multiple different reasons. General practice nurses have felt a little bit like they are left out, I guess. And that
You were saying Cinderella service to me before we went live. Yeah,
yes.
what did you mean by that?
So kind of the forgotten breed, I guess, the ones that are kind of there to mop up all the, the kind of, if you think about the things that bring, I guess, controversial, but the things that bring money into general practice, a lot of it's around chronic disease management and ticking boxes, etc. General practice nurses don't probably view it in that way, because they're utilising some incredible skills around health promotion and prevention of ill health. But the work that they do certainly does tick those boxes and create financial income and for practices. So they do a lot of the work, but maybe don't get much of the recognition, or as much of the recognition as they perhaps deserve. And that's kind of what I mean by the Cinderella complex.
Yeah, I think you're right, and people often talk about general practice in general as a Cinderella service, in terms of does a lot, not necessarily receiving a lot of the a lot of the funding coming out through the system. So so I get the sense that there's an important role in terms of supporting practice nursing. I guess there must be a kind of a system facing kind of element to the role as well. I guess the system probably perceives problems within nursing, and those might be around standards and training. I guess those might be around workforce issues like recruitment, retention, things like that. So are you having those conversations as well, I guess, at the more ICB level?
So we are looking at ways that we can help with all those areas, recruitment, retention, in particular, working with different. So looking at funding opportunities for training developments. So nurses who want to come into general practice, just to give you some examples. So if we're looking at recruitment in particular, looking at new to practice nurses, we're working with universities at trying to get general practice nursing on the agenda. We are and raise the profile of primary care as a nursing career straight from training, because it's not, it's something that perhaps hasn't historically been very high on the agenda, or the training has always been very directed towards secondary care. So we really want to kind of try and change that perception.
Rachel, can I ask a question?
Yes, of course.
Do all nurses get an attachment in general practice? Because there's been a lot of work done to make sure that all medical students come out to general practice a few times during their training, and I don't know whether is the same true of nursing.
Sadly, it's not. So there is a huge challenge around placements for general practice, and that's multifactorial. One of the big issues is that if you compare GP trainees, there's a lot of money attached to hosting a GP trainee registrar. The same cannot be said for nurses, unfortunately. There is a little bit of funding available, but it's pennies in comparison. So that's one of the issues. The other issue, of course, is the lack of, I guess, that inability to release staff to do the training. So, in order to house and place a student in a general practice, you need somebody to mentor them. You need a supervisor, and you need a sort of sign-off mentor. Now, that can be the same person, or it can be two different people, and you can share a student nurse. And these are the sort of things that we're trying to face. These are the challenges that we're trying to sort of address at the moment is, if you haven't got that capacity to house a student nurse, maybe you could share with a neighbouring practice. But of course, there's the element around who gets the money, who gets the reimbursement. As little as it is, as minimal as it is, that can still create.
Rachel, you're absolutely right. I'm just thinking, as a practice, we've recently had to make some difficult choices about whether we have medical students or nursing students, and actually the medical students bring with them a lot more resources to support releasing people's time to train them and debrief them, and actually if they come with that resource, it's really great, because that adds to the variety of the work that the staff doing to support them are able to do, and it's good for us, because it actually increases the attractiveness of our roles, within practice. But the same resources tend not to come with the nursing students. So I guess that
Yes,
must be something that you're kind of banging the drum about and fighting for.
very much
Yeah,
so. Yeah.
Rachel, just to pause there, I was going to ask you, and we asked this of most people that come on the PVP podcast, just to tell us about your journey to the role. We'll get back to all the juicy issues in a minute, but how did you come to be the lead nurse?
So I have worked in general practice or primary care, let's say, for almost 30 years. And I came into the role, I guess, in the way that people still traditionally feel that people do come into general practice nursing, and that was for ease in terms of childcare. And I was very fortunate. I had a really, really forward-thinking GP employer who was very keen to get me trained, and is very proactive and forward-thinking. So I was really lucky. And all through my career in general practice, which spanned about 20 years initially as a general practice nurse, I've had really good experiences. So I feel very fortunate, and I know that that's not the same for everybody. But during that journey, I've continued to sort of develop as a professional within my career. So I've taken on board additional training. I did all the usual kind of training that's required to do the job, but then I expanded further and sort of did the non-medical prescribing degree, and then more recently I did a master's in advanced clinical practice. But the journey doesn't really end there. There's a lot more to it. I worked for an organisation called NEMS, which many of you will know and have heard about, which is the out-of-hours provider for the whole of Nottinghamshire. And I was a clinical manager for NEMS, and I was involved in lots of different aspects, not just clinical management, but sort of clinical governance, audit, recruitment, retention, training and development. So lots and lots of different things. And that kind of, having completed the ACP, and at that time working back in general practice, I felt that I was not utilising a lot of the skills that I learned as an advanced clinical practitioner. And I wasn't using all the 4 pillars that you kind of learn as an advanced clinical practitioner. I was only using my clinical element. So I wanted to come into a role that allowed me to use those other 3 sort of pillars. and this was a really good opportunity to be able to do that.
Yeah, it's great. I think we're lucky to have somebody with that experience in the role, and it sounds like NEMS was a really good place to pick up a lot of relevant skills and experience around some of those words that we're going to come to later around recruitment, retention, these sorts of key issues. You were talking a little bit, I think you mentioned what was then and is still perceived as the traditional route into general practice, and I get a sense from talking to yourself and other nurses that there might be, or felt to be, a perception issue around practice nursing and what it is and who works in it, and that's something that you and others want to try and address. So what's the image problem with practice nursing, if there is one, Rachel?
No, very much so. And actually, this reminds me of a conversation I had recently with a new to general practice nurse who came into general practice nursing almost immediately from training as a student nurse. And she was a rarity in that that was all she ever wanted to do. And during her training, she shared this with her colleagues, and they were quite astounded. Well, what would you want to do that for? That's a retirement job, or that's a job you do when you need, you want to go part-time and work around your family. Well, those are good benefits, to be perfectly honest. Most general practice nurses don't have the night, the weekends, and they certainly don't have the night shifts. But another conversation I've had with a nurse who came into general practice nursing from a short career in secondary care, her colleagues said, "Oh, you're going to de-skill. Why would you want to do that?" Couldn't be further from the truth. So she was working in an area in secondary care. I think she was doing critical care, which, okay, that's quite sort of on the edge type work. She's going to have a lot of skills in that area, but she's quite pigeonholed also. Whereas coming into general practice, you're suddenly expanding that knowledge. You're going to have a huge breadth of knowledge in so many different areas. You become more of a generalist. So, and you can take that. The transferable skills are endless. And that's the kind of thing that she was trying to get across to her colleagues, that now she has this wealth of knowledge and experience in lots of different areas that she would never have had in a secondary care job.
Yeah, and of course I look at primary care nursing and I see just loads of possibilities and potential career routes. You know, just looking at the people working with us, we have so we have 3 nurse prescribers at our practice. We've got 10,000 patients. One of them is a nurse prescriber. He's also our practice manager because he has management experience, so he has a dual role, and he's a partner at the practice. You know, just like the 2 other GP partners, and taking a partnership share, like us. The possibilities are endless. And then another one of our nurses is doing some additional qualifications in sexual health, for example, to offer sexual health clinics. There's just loads and loads of possibilities. I think it's a really varied job, and the chronic disease management is technical. I mean, just look at diabetes care; it's enormously complex, and that is essentially run by a very, very skilled nurse at our practice. Sorry to run my mouth a little bit about it, but it's I think it's a hugely varied and rewarding career. It's fantastic.
It's a
I was going
very
to ask,
privileged
yeah.
career, I would say. Where else in the healthcare profession do you have the access to that close proximity of patients' lives from birth to death, pretty much. It spans the whole of your lifespan, and it is a privilege. It's an absolute privilege. And the other big thing about working in general practice is the level of autonomy that you would never get anywhere else. You're managing clinics, you're managing health, chronic diseases, you're managing vaccinations, immunizations, you're managing smears, you're managing sexual health. It's just, for me, it's a no-brainer.
Good. We're doing a good sales pitch here, but it is really good. And a few of my nurses actually, it's the hospital can be quite a political, and wards can be quite a political place to work, and they say they find it quite different working in a general practice team, which is nice, nice to hear. I was going to ask you what you feel about nursing apprenticeships. It's just something that came out in the NHS workforce plan, and we're going to have medical school apprenticeships as well, which I think is going to be really, really exciting, and opening up that career to people who might not have considered it before. What do you think about nurse apprenticeships? And
I think they're an amazing opportunity. And I've met a colleague recently who has just completed the nursing associate apprenticeship from being a healthcare assistant. And his plan is to take the whole route all the way through from healthcare assistant through to advanced clinical practitioner via the apprenticeship route. Again, it's a great opportunity that we've got in general practice to be able to do that, to be able to, take your whole career path through an apprenticeship levy, from HCA to advanced clinical practitioner, and I think it's a fantastic opportunity. I think there are some trusts that I think some colleagues in different trusts are finding it a little bit of a challenge, in that trusts won't release the levy, and so they're having to get that apprenticeship levy via different routes. Some of them are via PCN rather than sort of trust level, and that can cause some issues in that there's an apprenticeship whereby you share an apprentice across a PCN, and not everybody's okay with that or on board with that, but there are swings and roundabouts, aren't there? So sharing your workforce across PCN is a bit like the ARRS roles that have come out, and
it's tricky,
doing fantastic work,
yeah.
But may create a kind of feeling of instability if you're moving from one practice to another.
Yeah, and we were going to talk about the ARRS roles. I think let's talk about that in a second, because I was just going to ask, is there anything else around, because we've sort of talked about recognition and perception, I think. Is there anything else that you are involved in or wanted to say around supporting that recruitment aspect into general practice?
So we talked about working with the universities and raising the profile there. There is obviously there's new to practice apprenticeship as well. So if you've never done practice nursing, then the Nottingham Trent University do a new to practice apprenticeship, or like a preceptorship. So that would be teaching all the foundations of general practice nursing from the sort of core skills, if we call them that. So the ins and backs, cervical cytology, chronic disease management, the baseline core skills that are required. And then you build on that. Once you've got those skills in place, you build on that. In terms of sort of mid-career, which is not really about sort of looking at coming into general practice as a career, but for nurses, existing nurses who are wanting to expand their career, or maybe like with every job, you can get a little bit bored, and maybe looking for a new challenge. There's mid-career fellowship. There's funding currently for that, which will allow nurses to take on a project, which might be a service transformation or innovation within general practice. They might have a particular area of I don't know, that they might work in an area where the demographics have a particular sort of a big population of, say, multicultural issues such as language barriers, or those sorts of things, and maybe struggling to reach out to certain groups of people, and might want to do a project around that. So this would help to support that. It's a 12-month program and it's fully funded. So there's lots of opportunities for nurses in general practice.
Yeah, fantastic. And I guess at the end we'll give out some details about how people can learn about all of these opportunities and details, if people sort of stay tuned or fast forward to the end to find those. I was going to ask about retention. So for a long time we were talking about retention of GPs, or I was involved in a lot of conversations about keeping GPs in the profession and keeping GP time in the profession, and it's an issue for practice nurses as well, I'm well aware. What sort of issues are there, or and there might not be solutions yet, but what are the issues, what are the solutions, what's the conversation that's happening around retention?
So yeah, retention is always it's a big challenge, because I guess it's about keeping people interested in the role you're doing, and how do you keep that going? How do you sustain that for years and years? And how do we make it more interesting? How do we sort of make it more creative? And that kind of links in with the fellowship in some ways, in that that there are offers there on the table to kind of expand and grow your baseline, your portfolio. But I guess also there are lots of other things that you can become more involved in. You can specialise. You mentioned earlier about your nurses that have done the non-medical
Sexual
prescribing.
Health, yeah. Oh yes, I've done that.
Yeah, and then maybe specialise in the more sexual health. Nurses can now do coil fits, implants. They could run their own clinics. Menopause clinics is another one that's sort of growing in terms of general practice nurse management. They're taking on these clinics, managing them themselves, leading them themselves, with very little input from the GPs. Diabetes is another area where you'll find that nurses will manage the whole of the diabetes register without, and the GPs will be coming to the nurse and saying, bit stuck with this one.
Happens.
This is a complex one. Can you help?
I'll book you in the nurse to have a think about your diabetes medicine.
Exactly.
That definitely happens. I do see that quite a lot. Yeah. So I guess there's things towards not necessarily the end, but the more senior levels of the career, like yourself, you've moved into a leadership role, and I guess there must be other leadership roles both within nursing, but I see leadership roles, just general leadership roles within, the place-based partnership, the ICB, that I think nurses are ideally placed to move to as well. So I guess that must be part of the equation too.
Absolutely. And we do need that. We need more nurse voice at all levels from sort of practice all the way through to ICB, ICS. We need that nurse voice to run a strong voice to run through all the way.
So we'd mentioned we might talk about ARRS roles, and we mentioned that maybe it'll be a little bit controversial, because when we were preparing for this, it just sort of came up in conversation, really. And I think it's important to have these conversations, out in the open. So we were sort of talking about, I guess, nursing kind of feeling towards the ARRS, not the roles, not the people, but the structure of the contract and how the funding flows, really. What are some of the conversations that you're hearing, Rachel?
Yeah, I think there are such a valuable role in general practice at helping support, sort of reducing workload from the GP and increasing access to the GP by taking away some of that work that might have traditionally been considered, I guess, where there's not an option to refer out. So like your physios, but also your pharmacists who are doing med reviews, and I'm sure there are lots more jobs that they do. And I apologise to any pharmacists and physios that feel like I'm belittling their role, because absolutely not. I think they're incredibly valuable in general practice. The problem, I think, from practice nurses' point of view is some practice nurses are feeling a little threatened by these roles, and that's not unfair to say. The ARRS roles are protected funding wise, and there is a certain amount of equity across the board when it comes to their terms and conditions, and that's something that we don't see for practice nurses, which is a huge shame, and it's because of the way that general practice is funded. And not all nurses really understand the funding of general practice and how that comes down, and why they perhaps are being treated. There's an inequity across the board. So, from practice to practice. And I feel that that's one of the big challenges in terms of recruitment. Well, we know it's one of the big challenges. Studies have shown that's definitely one of the challenges in both recruitment and retention. So keeping people in place is getting more challenging when terms and conditions are inequitable.
Yeah, I agree. Really, it's challenging, isn't it? Because often, as you say, the ARRS money sort of doesn't really flow directly through practices. It's through primary care networks. They're employed in a completely different way, and often they are employed on agenda for change, like hospital contracts, whereas practice nurses are really employed on whatever terms they have agreed with their employing practice, which is normally the equivalent of a small or medium-sized business, and actually often those there's a lot of employer liabilities that come with an employee being on agenda for change. They're very quite long sickness pay periods, for example, which if you're a large hospital trust employing tens of thousands of people, you can probably manage that risk, whereas if you're just deploying a handful of clinical staff, it can be difficult to be on those terms. It's a really complicated area, isn't it? And I don't think enough GPs or other staff really understand it enough, and perhaps those people that design the systems by which we are commissioned and by which we pay people perhaps don't fully understand the impact of these things. It's difficult. So at least just talking about it and raising awareness of these issues, I think has a role. Rachel, we're sort of coming towards the end of our allotted time. I wanted to ask, though, it's a newish role. What challenges are you encountering in this role?
I guess the first challenge I've encountered, the biggest challenge I'm encountering is engagement, and which you'd think would not be such a challenge because we've identified that there's a need for that support. But I think you know, to be fair to general practice nurses, they're all very, very busy, as all, you know, as we all are, and they probably feel a little bit overwhelmed and bombarded by a lot of stuff, and you know, maybe also a little bit of what's the I'm trying to think of the right word here. I guess there's curiosity about my role and what I'm doing there, but you know, people approach new people in post very cautiously. You know, it's stumbling over the right words to say here.
Well, I think it's an interesting landscape, isn't it? And of course, I guess you're sort of employed, you know, money flowing through the ICB, often at general practice level. You know, the ICB is sometimes held with a little bit of, you know, suspicion, or at least they're not
That's
fully
good.
it's fully known what they're you know what they're up to, and what their reasons are for engaging with you sometimes. I'm just, you know, saying how it used to feel to me a little bit before I was involved with the ICB. You know, you don't know much about them, so you sort of, and general practice can be a little bit insular, you know, in terms of your own organisation. So you might be suspicious of outsiders, I guess, is what I'm saying. So maybe there's an element of that going on, Rachel. Perhaps it's about trying to break down those barriers.
Absolutely right, Andrew. I think you've hit the nail on the head. Suspicion is probably the word I would use, and you're absolutely right. People are suspicious of somebody new coming in. If you don't understand, well, why are you here? What are you doing? Why do you want to talk to me? What are you trying to gather? What information are you gathering? It's all a bit, like you say, insular, isn't it? And protected. But yeah, challenges are really just trying to increase the networking. And really get that engagement. So finding ways to really engage with staff on either a one-to-one level or via forums, or, you know, sharing information via newsletters, etc., and emails. So I'm just going to keep plugging away.
That's a good plan, which leads on to the next thing which we have on our document, which is the conference, 30th of April 2024. Sounds like a great opportunity to engage, you know, with nurses, and for nurses to engage with you as well. What's happening then?
Yes, so my sort of concept, my idea behind the conference was to really celebrate general practice nurses and the valuable work that we do. It was about recognition and also rewarding nurses for all the sort of efforts that they're doing on a daily basis. So the conference is going to be around sort of showcasing what we're doing. It's going to be based around the GPN strategy, and showcasing the work that we're doing around the strategy, but also incorporating innovations that are happening throughout Nottinghamshire that nurses have been involved in. So all the sort of projects and things that are ongoing and already completed, just to sort of highlight the kind of work that you can do as in general practice, and sort of really celebrate that work. The other thing that we're going to be doing is is an award ceremony. So you can nominate your colleagues for awards in 5 different categories. The information about that will all be coming out to nurses very, very soon. There'll be an Eventbrite.
That's interesting.
Going out. Yeah.
I might even nominate 1 or 2 myself, actually, if I get wind of that. That sounds like a great opportunity to celebrate people and roles, and, you know, what's going on, which is great. And so I gather it's going to be pitched at practice nurses. I guess, what about people who are maybe on a nursing pathway? You know, they might be a trainee or a nursing associate, healthcare assistant. What about those roles?
Yeah, absolutely. So anybody from HCA, so it'll be all HCAs, nursing associates, trainee nursing associates, general practice nurses will all be included in sort of the delegate invitations. So yeah, open to all.
Fantastic. So people can look out for that. And so Gemma, it's been great spending time with you. I called you Gemma. Your name is Rachel. Apologies.
Okay.
Been great spending time with you this afternoon. The last question that we ask people on this podcast is, you know, what should people do immediately after they finish the podcast? You've got people's attention. What would you like people to do next?
So there's a couple of things. The first thing is, you know, you can contact me directly or either of my colleagues, Gemma, Bird or Kirsten Taylor. I think the emails should be coming
on screen, I think.
Screen at the end, yeah. So that's one thing you can do, and we will put you in direct contact with any, depending on what your query is. NAF is also another good contact. And if you're new to practice or thinking of coming into general practice, there are a couple of interesting articles within both the NMC and the RCN websites that talk about what it is to be a general practice nurse. Or there's also the primary care competency framework that's a live document that you can have a look at and access, and that's a kind of looks at the different pathways into a sort of different, not pathways, do apologise, the skill matrix, the skill mapping of sort of general practice nurses, and from foundation all the way up to sort of advanced level. So that's always a useful document.
Fantastic. So I guess we'll wrap it up there. It's been fantastic hearing about your role as lead nurse. So thank you very much, Rachel, and thank you everybody who's been listening or watching. It's been fantastic to have you along, and hopefully you'll join us for another place-based partnership podcast. Thank you very much, everybody, and thank you, Rachel. Bye bye.
Thank you. Bye.